significantly over the last decade or so across the population. Primary care is seemingly less popular and clearly was not helpful in preventing at least the chronic disease epidemics that we have.
Versus large primary care groups that are following a value-based care model. Are you looking over your shoulder at their treatment plans?
Right. I mean, generally, primary care visit rates are down pretty significantly over the last decade or so across the population, right? So, primary care, at least in its current form, is becoming seemingly less popular and clearly was not helpful in preventing at least the chronic disease epidemics that we have. So at the same time, primary care is incredibly important to society and everyone should see their primary care physician. But the reality is those physicians tend to be pretty busy with a full book, and they tend to place a lot of their time on the folks who are coming in frequently, maybe with blood work every 3 months, managing a chronic condition. So someone who walks in with a 5.5 or 5.6 A1C and looks generally fit, they're going to say, well, great, keep doing what you're doing, see you next year. And that's missing a lot of the opportunity for improving that person's health, right? Because 5.5, 5.6 A1C is certainly up there, creeping up against pre-diabetes levels, even if it's considered in range. Certain various studies suggest that even every half point decrease in A1C reduces coronary heart disease by more than 20%. And so if you reframe this from how can I help you kind of avoid chronic disease to how can I help you achieve optimal health, whatever that might mean for you. I think that's really where preventive care is going. It's more proactive. It's patient led. They're demanding great customer service because they're often paying with cash. It's often cash pay, and so you're seeing this model of cash pay care kind of blossom because there's just no great way of getting that from kind of the traditional healthcare system.
Right, technology being what it is, it's really almost like a perfect conduit through which to deliver something that's been missing, which is stochastic, real-time, recurring oversight, coaching, assistance, which no primary care physician can provide 24 hours a day, 7 days a week. And every primary care physician has their way of interacting. Superimpose on that AI. So now you're augmenting the level of interaction with ever higher degrees of intelligence, and superimpose on that a consumer base that is rapidly becoming ever more intelligent. By the way, AI helping that process along as well. What used to be a massive knowledge gap between a blood test provided or recommended by a primary care physician, the results of the blood test, and a primary care physician summarizing the results, is now an in-depth audit provided by an LLM model directly in response to a plethora of questions by a patient that then causes the patient to reach out to Noom to say, hey, I have a problem here and I need 24-hour-a-day monitoring. So it's a wonderful cycle that keeps on, I think, bringing more and more consumers to you.
Yeah.
So I'm wondering, are you seeing that growth from year to year?
Absolutely. I mean, the company is firing on all cylinders right now. I mean, the mega trend that we see is really this convergence of diagnostics, this testing, blood testing is getting cheaper and cheaper. It's becoming more and more commodity. At the same time, the number of tests are increasing. So you have diagnostics, you have convenient access to clinical care, right? Like that. That's another kind of key trend. But you have diagnostics converging with convenient care, and then you have that converging with lifestyle support. And so an example of this is, you think of Whoop and maybe Aura in lifestyle support. You probably might think of Noom. Whoop and Aura are wearables, but you saw each of them launch blood tests. Yeah, me too. I have the Whoop on. But you see diagnostics kind of blending with Whoop and Aura now. And then you see Hims, of course, recently launched diagnostics and talk about the importance of habits, at least. Noom has a significant care business, very interested in diagnostics. So I think multiple of the kind of the most interesting players in the space are probably all seeing the world pretty similarly. And it is generally all through this lens of AI, because how could you possibly, to your point, make sense of 100 different biomarkers and all of your wearable data,
It
your
really is the
clinical.
last shoe to drop. You couldn't get there 5 years ago.
Exactly.
So Chat GPT is really the door through which all these preventative care apps need to have walked through.
Yeah, I think that's right. I think you're going to see, and you do see like every significant player in this space having AI as a critical aspect of what they do. We've been using it in our coaching interactions to help the coach make the right decision. We have this no empty boxes concept where we should, as you might expect, have an LLM that kind of looks at all of the data from the member and is suggesting to the coach something, and then that coach can decide and edit that. But then we also leverage AI to even do things like transdermal optical imaging using the smartphone camera. You simply look at the smartphone camera for 30 seconds and it will read the blood flow in your face and predict various biomarkers like heart rate, biological age, kind of a litany of interesting kind of screening indicators. And then from there, that might lead you to consider a blood test or ideally a behavior change program or maybe even a GLP.
So if you had to forecast going forward, I'll ask you two questions from a forecasting perspective. One is, does the rise of preventative care effective solutions, effective products like Noom, result in further curving of the cost curve? So we go from 17.5%, which we've been at for 15 plus years of GDP, down to 15, 12, 10%, because we're just not delivering a high volume of chronic disease into the marketplace. We're preempting it. And you're seeing a shift of spend into preventative care, which is far less expensive than high acuity chronic care. You're seeing a shift away from invasive procedures and into non-invasive behavioral change. Is that a fair prediction going forward? Or will we end up with plus plus, which is where we've typically been in healthcare?
Right.
Whatever you add ends up being an addition to what is already being spent.
Mm.
And the second question is, you've built really successful consumer-facing apps in the past and platforms like the Meet Group. And I'm reminded of innovators like MySpace that had very high expectations entering a new category with digital footprint solutions that were widely adopted, only to discover that the space lends itself to a single solution. Is there going to be a single winner in this space? And if so, will it be Noom?
Great question. So on the first one, I do think it's different this time, right? I think you're starting to see the obesity curve, which it could be kind of a proxy for the metric you're kind of thinking about.
It really is a proxy. It definitely is a proxy.
Right. We're starting to see that bend, which is great and clearly related to the rise of GLP-1. And that's while GLP-1s are still quite expensive. So as you imagine that price falling as you get into the 20s and some of the most effective GLP-1s become generic, it's hard to imagine that not continuing to bend down. So I do think you'll see that cost curve bend. We're, as far as the dynamics of, is this kind of a winner take all? It probably isn't winner take all. I'm not sure it's the same dynamics as a social network where you have such significant network effects. But I do think that at the end of the day, what differentiates Noom is one, powerful, trusted brand. Two, and is that engaging application. And we think of it as we're trying to build the Duolingo for health, right? Duolingo famously takes a US population that isn't particularly known for its love of second languages and somehow creates an extremely valuable asset while providing an extremely useful service to people who might never have otherwise thought to engage in second language. And so how do you make health fun? How do you make it healthy habits stick by essentially making them fun? And that's a lot of what we think about. It could start to take on those winner take all dynamics as you bring social more into them. And that's partly why we're so excited about the social side. But I think, remains to be seen. But I do think there will only be so many scaled players, 5 years from now in preventive health. But I would guess there's more than one.
There is a social networking effect, which is interesting, which is in the dialogue. The corridor water bottle conversations taking place between peer group users. You see that with Whoop. What's your Whoop score? What's your Whoop score? So it is interesting how it manifests almost outside of the actual application itself, just in second derivative conversations amongst users. It becomes part of the lexicon. Did you Noom today? That the winner ends up occupying that seat without necessarily. It's the rewards of being the best in class, which I think is probably going to be a function of efficacy and execution, right? Execution in marketing, execution in strategic partnerships, execution in pricing. But ultimately, you get additional rewards that you didn't even bargain for. You become part of the lexicon.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.